Let's talk about your hearing for a little bit. Kind of the joke around my house is that my husband, I say, has selective hearing. He would say the same thing about me. But if you are really going through a bit of a hearing loss, especially if it's a sudden hearing loss, that's a very, very significant problem and one that you want to get taken care of quickly. So says Dr. Tiffany Ahlberg with Ahlberg Audiology, who's back on the show with us this morning. Good to see you.
Good to see you too.
It is kind of a joke around my house that we both have selective hearing.
Well, we say we're part audiologists, part marriage counselors in our office because we can only help with hearing and not listening.
Okay, you know what though? That's a very valid point before we talk about the sudden hearing loss. Because if you really are experiencing hearing loss, it can come on gradually often. And so you see people struggle for years without getting treatment for it, and that does create a problem within the family.
Yeah, I think a lot of times people think, I do not have a hearing loss. I hear. My only problem is understanding. And it's so difficult to understand how hearing works and how you can hear some sounds but not others. So you can hear the vowels and sounds and not the consonants, and so you hear part of a word. It's like playing Wheel of Fortune without certain sounds to choose from.
So when people come to you, often you see if it's a couple, like if it's a husband, the wife comes too, or vice versa. Can't the hearing spouse hear what the struggling spouse is going through?
A lot of times she's like, yeah, you know, he can't hear the timer on the refrigerator, or that makes sense. He doesn't hear the, you know, the timer going off on the oven. And so there are environmental sounds that are in the same frequency range as some of those speech sounds that are a dead giveaway that that's the frequencies that you're not hearing.
But you're able to also simulate for them what the husband might be experiencing, right? You can put on like a headset and hear what he hears.
We do have a filtering speaker that we can simulate like what that person is hearing without some of those frequencies. So yeah, we can do that.
So that one is a bit of an inconvenience and something that just a lot of us will face as we go through our lives. Sudden hearing loss is totally different, and that's a worry.
Yeah, we have had this influx of people here recently that have had this, and so that's why I wanted to touch on this today. But if you feel like all of a sudden your ear is full and you're not hearing certain sounds and it feels like you need to pop your ear, I mean, sometimes it can be fluid. It can be fluid, it can be negative pressure, or there is a condition that's idiopathic sudden sensorineural hearing loss, and it's just where you have a drop in hearing and you lose your hearing. It is so important. There are treatment options that ENTs can provide, but those have to be, the sooner the better on those, and ideally it would be within 48 hours of experiencing that the treatment would begin for best case scenario to help improve that to come back.
So what you would be able to do is if someone is watching, they're experiencing that, they call your office and say, this is what I'm dealing with, you get them in right away.
Yes, because the ENTs are so hard. We have such awesome ENTs in our area. They are super busy. They are so over, booked. They're booked out, months a lot of times. And so we're able to do a hearing test, figure out what is it? Is it fluid, which isn't as necessary to get a treatment like as soon as possible, but the sudden sensorineural hearing loss we have to. So they're really good about getting people in as soon as possible so that they can provide treatment for that.
If you are a person who's ever experienced a sudden hearing loss that is the idiopathic version, is it possible that you'll have that again? Yeah. Can you be a repeat?
I'll just kind of put myself out there. I've had it twice in my life.
Really?
Where I have completely lost my hearing in my left ear. I was able to do a steroid treatment within 24 hours, and it, recovered mostly. So, but I've had it twice.
When it happened to you the first time, since you've opened up that door, were you already an audiologist?
Yes.
So you knew?
I knew it was.
Do you think, looking back on it, if you had not been?
Yeah.
Do you think you would have known the severity of it?
It was awful though. You just feel like your ear needs to pop, and so it's just a horrible feeling to just feel like that side of your head is empty.
I guess that's it. When you know something's not right, you know something's not right.
Yes.
It is very important, however, that they stress that on the phone with you when they call.
Yes, definitely. Yes, we saw somebody yesterday that had waited 2 weeks to come in, and
Oh my gosh.
and so we just want to make sure that it's something that people tell us so that we can get them in as soon as possible.
Doesn't happen at different times of the day? Like, is it more prevalent in the morning than at night?
Most of the time, people wake up with it.
Okay.
So you wake up with it, and you feel like your ear is just full, and that's what a lot of times it is.
Well, I mean, this is, I guess, a good thing, because if you do get the treatment early, it can be corrected. Once you have a hearing loss, all you can do is try to keep it from getting worse.
That's
Can't be
correct.
repaired. So we're
Yes.
heading into lawn cutting season and yard work season. Wear that hearing protection.
Always, always. I cannot stress it enough, and I always beg people, please wear your hearing protection. It's something that we cannot get back, and so we have to protect it. Even if you have a hearing loss, protect what you got, because it'll get worse.
As far as the sudden hearing loss that might not be the idiopathic, but it could be fluid or wax, do you like, when kids are about to hit the water to swim, do you like wearing earplugs?
Not everybody needs to wear earplugs.
Okay.
Using like the swim ear drops, if you're going to a public pool, alcohol, anything like that after swimming in either a river, lake, or public pool is a really good idea.
Okay.
Earplugs are mostly for people that maybe have tubes in their ears or something like that.
One more plug for you, because I've learned well with you over the years. Get that baseline hearing test, because then if you do have that sudden hearing loss,
Yep.
you know what to compare.
Exactly. That is a very good point, yes.
And at what age should you do that?
I have people now in their 40s coming to get it, but we want to have that, around age 50.
Okay, so here's where you find her, up in Cleveland on North Ocoee Street.
And Athens now, too.
You've opened it.
Yes. 7
Congratulations. That's
Thank
been a
you.
long time in coming. So now she has 2 locations.
Yes.
Cleveland and Athens, 641-0956, ahlbergaudiology.com. And if you want to get the address for the Athens location, can they just call your Cleveland
Yes,
office?
absolutely.
Congratulations.
Thank you.